Everyone, this is I will teach you medicine, and we are discussing about corrosive poisoning. So, what is corrosive? Corrosive भनेको चाहिँ it is a substance having corroding or destructive effects on the human. यसले corrode गर्छ क्या, त्यही भएर नामै corrosive छ है. It is exclusively local acting, मतलब यसले चाहिँ एकदम लोकली जहाँ पर्यो यो corrosive त्यहाँ मात्रै एक्ट गर्छ है. तर कुनै कुनै चाहिँ सिस्टमिक इफेक्ट पनि गर्छ है, विथ द एक्सेप्सन अफ जेनरलाइज सक. त्यसमा चाहिँ जेनरलाइज सक चाहिँ हुँदैन है. सो अब यस्तो दुईवटा टाइप अफ कोरोसिभ हुन्छ कि, त्यो भनेको त कि त एसिड हुन्छ कि त एल्कालिज हुन्छ है. सो एसिडमा सी छ भने चाहिँ के हुन्छ भन्दाखेरि यसले चाहिँ एसिडहरू जुन कोरोसिभ एसिडहरू छन् तिनीहरूले चाहिँ के गर्छन् भन्दाखेरि चाहिँ कोआगुलेटिभ नेक्रोसिस गराउँछन् भने अल्कालीले एएल यो निमोनिक होइन, एलले चाहिँ लिक्विफ्याक्सन नेक्रोसिस गराउँछ है. सो अब क्लासिफिकेसन अफ कोरोजिभमा चाहिँ के हुन्छ भन्दाखेरि चाहिँ कि त अब एकदम स्ट्रङ एसिडले गर्छ होइन, कि त स्ट्रङ अल्कालिज हुन्छ कि यसमा चाहिँ होइन. अर्को भनेको चाहिँ मेटालिक सल्ट है. यो स्ट्रङ एसिड र स्ट्रङ अल्काली मिसेर बन्यो भने चाहिँ के हुन्छ भन्दाखेरि धेरै सल्ट बनाउँछ है. सो यसले चाहिँ मेटालिक सल्ट बनाउँछ है. सो अब यसको क्लासिफिकेसन चाहिँ एकदम घोक्नुपर्छ है. सो अब यसमा स्ट्रङ एसिड भने चाहिँ दुईवटा सम्झिनु पऱ्यो कि त मिनरल हुन्छ कि त अर्ग्यानिक हुन्छ है. अब अर्ग्यानिक या इनअर्ग्यानिक भन्यो नि भयो. अब अर्ग्यानिक, अब इनअर्ग्यानिक या मिनरल भनेको चाहिँ मिनरलबाट एक्सट्र्याक्ट गरे जस्तो, त्यो भनेको चाहिँ के हुन्छ भन्दाखेरि चाहिँ सल्फ्युरिक एसिड भयो, अर्को भनेको नाइट्रिक एसिड, अर्को भनेको हाइड्रोक्लोरिक एसिड होइन, HCl मिनरलमा चाहिँ हो. अब भनेको अर्ग्यानिकमा चाहिँ के हुन्छ भन्दाखेरि चाहिँ कार्बोलिक भयो, अनि अर्को भनेको चाहिँ अक्जालिक एसिड भयो, अर्को भनेको एसिटिक एसिड भयो, अर्को भनेको स्यालिसाइक्लिक एसिड है. सो यिनीहरू चाहिँ अर्ग्यानिक भनेको. त्यही भएर चाहिँ अब यसको निमोनिक भन्नु चाहिँ के भन्नु भने SNH र COAS है. एस भनेको सल्फ्युरिक एसिड, एन भनेको नाइट्रिक एसिड, एच भनेको हाइड्रोक्लोरिक एसिड है. त्यसपछि अर्को भनेको चाहिँ COAS क्वास है. सी भनेको कार्बोलिक, अक्जालिक, एसिटिक अनि स्यालिसाइक्लिक एसिड. त्यो भनेको सबै केमा पऱ्यो भन्दाखेरि चाहिँ स्ट्रङ एसिडमा पऱ्यो, माथिको मिनरल तलको अर्ग्यानिकमा है. अर्को भनेको चाहिँ अब के हुन्छ स्ट्रङ एल्काली है. सो एकदम स्ट्रङ एल्कालीले के गर्छ लिक्विफेटिक नेक्रोसिस है. सो स्ट्रङ एल्कालीमा के पर्छ भन्दाखेरि चाहिँ हाइका है. त्यो भनेको चाहिँ हाइड्रेट्स र अनि कार्बोनेट्स है. हाइड्रेट्स र कार्बोनेट अफ सोडियम, पोटासियम र अनि त्यसपछि चाहिँ अनि एमोनियम है. हाइका एमोनियम भन्ने हुन्छ कि हाइका नाक एमोनियम है, HYCA अनि NAK अनि एमोनियम है. सो स्ट्रङ एल्कालीमा हो भयो है. अघि हामीले के पढेको थियौँ स्ट्रङ एसिडमा SNH अनि त्यसपछि COAS होइन, त्यसपछि चाहिँ अनि S भनेको सल्फ्युरिक एसिड, N भनेको नाइट्रिक एसिड, H भनेको हाइड्रोक्लोरिक एसिड, अनि यतापट्टि चाहिँ C भनेको चाहिँ कार्बोलिक एसिड है अर्ग्यानिक एसिडमा, अनि त्यसपछि चाहिँ अनि O भनेको अक्जालिक एसिड, A भनेको एसिटिक एसिड, अर्को S भनेको स्यालिसाइक्लिक एसिड है. अनि त्यसपछि यतापट्टिको यो स्ट्रङ अल्कालीमा चाहिँ के पर्छ भन्दाखेरि चाहिँ त्यसमा चाहिँ हाइका भनेको हाइड्रेट भयो, अनि त्यसपछि चाहिँ अनि का भनेको कार्बोनेट अफ नाक र अनि एमोनियम Na भनेको सोडियम, के भनेको पोटासियम, अनि त्यसपछि चाहिँ अनि एमोनियम NH4 को है. अब अर्को आउँछ मेटालिक सल्ट है. मेटालिक सल्टमा चाहिँ के हुन्छ भन्दाखेरि चाहिँ अब मेटालिक के, अब यसमा चाहिँ के हुन्छ भन्दाखेरि चाहिँ अब दुईवटा, अब यसमा चाहिँ सुनिरहेको नाम जस्तै हो कि, यो भनेको चाहिँ के हुन्छ भन्दाखेरि चाहिँ जिङ्क क्लोराइड, कपर सल्फेट, जिङ्क क्लोराइड, कपर सल्फेट, अनि त्यसपछि चाहिँ अनि पोटासियम साइनाइड है CN भनेको, अनि FeCl भनेको चाहिँ अब फेरिक क्लोराइड र आइरन क्लोराइड पनि भन्छ है. सो यो हामीले क्लासिफिकेसन के को गऱ्यौँ भन्दाखेरि चाहिँ कोरोसिभको क्लासिफिकेसन. सो तीनवटा क्लासिफिकेसन छ, स्ट्रङ एसिड, स्ट्रङ अल्काली र मेटालिक सल्ट है. अनि त्यसपछि अब स्ट्रङ एसिडमा के हुन्छ भन्दाखेरि चाहिँ मिनरल, इनअर्ग्यानिक र अर्ग्यानिक है. अब इनअर्ग्यानिकमा के हुन्छ भन्दाखेरि चाहिँ SNH राइट. एच भनेको सल्फ्युरिक एसिड, एन भनेको नाइट्रिक एसिड, अनि त्यसपछि चाहिँ अनि एच भनेको चाहिँ हाइड्रोक्लोरिक एसिड HCl है. त्यसपछि चाहिँ अनि यतापट्टि तल आयो, त्यो भनेको चाहिँ अब अर्ग्यानिक होइन. अर्ग्यानिकमा चाहिँ के हुन्छ भन्दाखेरि चाहिँ COAS भनेको के हुन्छ भन्दाखेरि C भनेको कार्बोलिक एसिड, O भनेको अक्जालिक एसिड, A भनेको एसिटिक एसिड, S भनेको स्यालिसाइक्लिक एसिड राइट. अब आउँछ तलपट्टि स्ट्रङ अल्कालिजमा के पनि छैन, हाइका नाक एमोनियम होइन, हाइका नाक एमोनियम, HY भनेको हाइड्रेट्स एन्ड कार्बोनेट्स अफ, NAK भनेको चाहिँ Na अनि K भनेको चाहिँ सोडियम, पोटासियम एन्ड एमोनियम है. त्यसपछि अर्को भनेको चाहिँ मिनरल मेटालिक सल्ट है. मेटालिक सल्टमा के हुन्छ सुनिरहेको होइन, त्यो भनेको के हुन्छ जिङ्क क्लोराइड होइन, कपर सल्फेट, त्यसपछि अर्को भनेको चाहिँ पोटासियम साइनाइड, अनि त्यसपछि अर्को भनेको चाहिँ अनि फेरिक क्लोराइड है. सो यो भनेको भइहाल्यो. अब यसले कसरी काम गर्छ है त, यो मेकानिजम अफ एक्सन अफ कोरोजिभवाला कुनै पनि यो हुन्छ नि टक्सिनले चाहिँ के गर्छ भन्दाखेरि चाहिँ यसले के गर्छ भन्दाखेरि एक्सट्र्याक्सन अफ वाटर फ्रम द टिस्यु. यसले चाहिँ कुनै पनि एउटा टिस्यु भयो, एउटा सेल भयो है, यहाँ माइटोकन्ड्रिया यताउति छ, त्यसमा कोरोजिभ हाल्यो भने के हुन्छ यसकोबाट फ्लुइडहरू चाहिँ सबै निस्किन्छ क्या बाहिर है. अर्को भनेको चाहिँ अब सेलुलर प्रोटिन हुन्छ नि, यो भित्रको जुन प्रोटिनहरूले बनेर हुन्छ सबै प्रोटिन त हो नि राइट, DNA इज अ प्रोटिन राइट. सो के हुन्छ भन्दाखेरि यसलाई चाहिँ कोआगुलेट गरिदिन्छ कि होइन. सो के गर्यो भन्दाखेरि चाहिँ पहिला सुरु यहाँको चाहिँ अब फ्लुइडहरू हुन्छ नि त्यसलाई चाहिँ वाटरलाई चाहिँ टिस्युबाट निकालिदियो. अर्को भनेको यो सेलुलर प्रोटिनलाई चाहिँ कोआगुलेट गर्यो, अनि अर्को भनेको चाहिँ हिमोग्लोबिनलाई चाहिँ हेमाटिन बनाइदिन्छ है, RBC होइन, यो बाइकन्केभ RBCको चाहिँ यसमा चाहिँ हुने चाहिँ अब जुन हिम हुन्छ त्यसलाई चाहिँ अनि हिमोग्लोबिन हुन्छ त्यसलाई चाहिँ के बनाउँछ भन्दाखेरि हेमाटिन बनाउँछ है. सो त्यही हो मेकानिजम अफ एक्सन कोरोसिभ। अब भिट्रियल एज भनेको चाहिँ एकदम इम्पोर्टेन्ट कुरा है। अब यसले भनेको चाहिँ के हो भन्दाखेरि चाहिँ लिटरली मिन्स थ्रोइङ अफ ओइल अफ भिट्रियल है। सो ओइल अफ भिट्रियल भनेको चाहिँ सो वी क्यान सी है यहाँ हुन्छ है। यसमा चाहिँ के छ भन्दाखेरि चाहिँ अब यो भनेको चाहिँ हाम्रो जुन त्यो सल्फ्युरिक एसिड छ होइन, सल्फ्युरिक एसिड चाहिँ कसैले अब यसरी फाल्यो होइन, कसैले त्यो अब एसिड फाल्ने भन्ने त्यो जुन त्यो हुन्छ नि देखिरहेको हुन्छ नि न्युजहरूमा पनि है। सो सल्फ्युरिक एसिड यसरी मुखमा हालिदिएपछि यस्तो हुन्छ कि है, यो भनेको कोरोजिभ हो है। जस्ट वान्टेड टु मेक यु लाइक भिट्रियोलेज पनि भन्छ त्यसलाई है। सो यही हो। ओके, नाउ द पिक्चर्स आर डन, लेट्स गेट ब्याक। So literally means throwing of oil of vitriol, that is sulfuric acid, on the body of a person with the intention of injuring or disfiguring him or her out of jealousy of revenge। यो भनेको एउटा क्राइम है, यो भनेको ग्रिभियस हर्ट है। सो द अट्याक्स आर मोस्टली क्यारिड आउट बाई हस्बेन्ड, बोयफ्रेन्ड्स अर रिजेक्टेड स्विटर्स है। यो एकदम ब्याड कुरा हो है। सो नेपाल गभर्मेन्ट हेज अल्सो पास एकदम राम्रो खालको ल अहिले रिसेन्टली for this to stop this crime, right? So practically this term is used in all cases of throwing of any corrosive agent on the body, not just sulfuric acid, not just H2SO4, but कुनै पनि एसिड होइन कोरोसिभ, कुनै पनि स्ट्रङ एसिड होइन, त्यो पऱ्यो भने चाहिँ के हुन्छ भन्दाखेरि यसलाई चाहिँ भिट्रियोलेज भन्छ है। थ्रोइङ अफ एसिड भनौँ न, एसिड स्पेसली चाहिँ ओइल अफ भिट्रियोल, राइट? सो त्यो गऱ्यो भने चाहिँ अनि हुन्छ है। यसलाई चाहिँ युजल टार्गेट भनेको फेस हो, किन भन्दाखेरि डिफेन्ड गर्ने अनि त्यसपछि इन्जुरी गर्ने, जेलेसी, रिभेन्ज यस्तो यस्तो कुराले गरेर हुन्छ है। सो मे कज लस अफ आइसाइट, आँखामा पर्न सक्छ, अनि त्यसपछि पर्मानेन्ट डिसफिगरेसन है, अनि त्यसपछि कन्ट्र्याक्चर्सहरू हुन्छ। कन्ट्र्याक्चर्स चाहिँ अघिको जस्तै अब यसमा देख्न सकिन्छ यहाँ कस्तो पुरै कन्ट्र्याक्ट भएको छ नि, कन्ट्र्याक्चर्सहरू भएको छ नि फेसमा, राइट? सो यही नै हो है कन्ट्र्याक्चर भनेको चाहिँ। सो अब यसलाई चाहिँ के गरिन्छ भन्दाखेरि ग्रिभियस इन्जुरीमा चाहिँ हामीले राखेको छ है, हाम्रो यो लाइक लले चाहिँ ग्रिभियस इन्जुरीमा राखेको छ। मे कज डेथ इफ एक्सटेन्सिभ एरिया इज इन्भल्भ है। अब यसले फेस मात्रै लाइक फेसमा मात्रै पार्यो होइन, मान्छेको फेसमा मात्रै पार्यो होइन। अब यसलाई चाहिँ के गर्यो, यसलाई अब एसिड फाल्यो होइन, यसको चाहिँ अब डिसफिगरमेन्ट भयो होइन, यो भनेको चाहिँ ग्रिभियस हर्ट भयो है, ग्रिभियस हर्ट भयो। तर यो यसले गर्दाखेरि यो मान्छेको डेथै भयो, राइट? सो एकदम धेरै नै इफेक्ट भयो, डेथ भयो भने चाहिँ यो के हुन्छ भन्दाखेरि होमिसाइड हुन्छ, इट्स नट हर्ट एनिमोर, लाइक हर्ट एनिमोर है, त्यो भनेको इन्जुरी होइन है। सो यो चाहिँ होमिसाइड पनि मानिन्छ है। सो अब यसमा चाहिँ के गर्नुपर्छ भन्दा इमिडिएट ट्रिटमेन्ट भनेको चाहिँ के गर्ने भन्दा फ्लस विथ लार्ज एमाउन्ट अफ वाटर, भनेको पानी रनिङ वाटर के, रनिङ वाटरमा चाहिँ वास गर्नुपर्छ कि है, वास गर्नुपर्छ। अनि त्यसपछि अर्को भनेको चाहिँ टोपिकल एन्टिबायोटिक ओइन्टमेन्ट लगाउनुपर्छ, किन भन्दाखेरि अब लिटरली त्यो बर्न भइरहेको नि त, केमिकल बर्न भइरहेको नि त, त्यसमा चाहिँ के हुन्छ भन्दाखेरि अब कोएगुलेसनहरू, लिक्विफ्याक्सनहरू भइरहेको हुन्छ, जसले गर्दाखेरि चाहिँ अब त्यहाँ अब अपर्च्युनिस्टिक अर्ग्यानिजमहरू आएर त्यहाँ अब झन् त्यसलाई कम्प्लिकेट गर्न सक्छ। सो ओइन्टमेन्ट एन्टिबायोटिक इज भेरी इम्पोर्टेन्ट अनि फ्लस विथ लार्ज एमाउन्ट अफ आँखाको लागि आइसको लागि चाहिँ के गर्छ भन्दाखेरि चाहिँ लार्ज एमाउन्ट अफ वाटर एन्ड फरेन बडी इरिगेसन विथ 1% सोल्युसन अफ सोडियम बाइकार्बोनेट, राइट? सो आँखामा चाहिँ 1% सोल्युसन अफ सोडियम बाइकार्बोनेट, कार्बोनेटले चाहिँ यसलाई फ्लस गरिरहनुपर्छ। नत्र भए यसको मेन ट्रिटमेन्ट भनेको चाहिँ के हो भन्दाखेरि रनिङ वाटर वास गरेको आधा घन्टादेखि 2-3 घन्टासम्म गर्दा नि गर्नुपर्छ कि यसमा चाहिँ है। सो भिट्रियोलाइज भयो भने चाहिँ त्यो हुन्छ है। अब पढौँ एक एक गुन्डा है कोरोसिभमा। यसमा के हुन्छ सल्फ्युरिक एसिड, जसलाई चाहिँ के भन्छ H2SO4 पनि भन्छ है केमिकल नेम, अर ओइल अफ भिट्रियल भन्छ है। सो यो सल्फ्युरिक एसिड भनेको चाहिँ कस्तो हो, लाइक यु हेभ सिन इन योर केमिस्ट्री क्लासेस एन्ड अल इन हाई स्कुल, राइट? सो दिस इज सल्फ्युरिक एसिड, राइट? हेर्दाखेरि कस्तो केही पनि छैन नि होइन, क्लियर पानी जस्तै छ नि त होइन। सो दिस इज सल्फ्युरिक एसिड अनि सो इट इज अ कलरलेस, orderless, no order is formed, non-fuming, okay, that one figure was, so this figure is like really like inappropriate, like you know it's misguiding us. So it's non-fuming, all right, colorless, orderless, non-fuming. This is not like this is just a graphical representation of sulfuric acid, but it does not fume. Heavy, it is very heavy and hygroscopic, and it is a very oily liquid, though you should not touch it right? So it's sulfuric acid at the end of the day. So fatal dose is 10 to 15 ml, right? So small one big spoon, like spoon, that can also cause death, right? Fatal dose, and then fatal period is 12 to 24 hours, right? of sulfuric acid 12 देखि 24 घण्टासम्म हुन्छ। सो सिम्पटम्स होइन, साइन्स एन्ड सिम्पटम्समा के हुन्छ भन्दाखेरि चाहिँ लिप्स आर सोलन एन्ड एक्सकोरिएटेड, ओके, एन्ड देन ब्राउन अर ब्ल्याक स्ट्रिक्स एक्सटेन्डिङ फ्रम द एङ्गल अफ द माउथ टु द साइड अफ द चिन। सो इन दिस फिगर वी क्यान सी, सो एङ्गल अफ माउथबाट चाहिँ चिनसम्म चाहिँ यस्तो ब्ल्याक कलर भइरहेको छ नि त यो सबै है। सो द्याट इज साइन एन्ड सिम्पटम। And then other includes like mucous membrane of the mouth, throat and esophagus, that will cause like corrosion. And then teeth, extremely acidic, right? So it will cause a chalky white color of the teeth, okay. And then tongue is swollen, it is black, okay, because of all the ulceration and the corrosion. And then dysphagia, of course, because it is corroded, right? Odynophagia. And then pharyngeal pain will also occur, and also epigastric pain, which spreads all over the abdomen and the thorax. So these are the signs and symptoms. So if someone drinks an acid, so lips become swollen and excoriated. And then there is a like brown and black streak extending from the angle of mouth to the side of the chin, right? So angle of the mouth to the side of the chin. And then corrosion of the mucous membrane is all of the mouth, throat and esophagus, it's all corroded. And then teeth is very very chalky white. And then tongue becomes swollen and black. And dysphagia, odynophagia, and pharyngeal pain. And also in the stomach, what happens is epigastric pain, okay, which spreads over the abdomen and the thorax. So you can see here, look, the black streaks where the like chemical H2SO4 has been formed down, okay. So what is the treatment? It's the treatment, so gastric lavage is like very much avoided in corrosive poisoning, right? So so wait a minute. Sorry for that. So gastric lavage is contraindicated, okay. So what we have to do is demolitions, that is egg white or milk or olive oil or melted butter, okay. So demolition, egg white, milk, olive water and melted butter, so that is given, okay. And then prednisolone for to prevent the because in the like acid corrosion, so what happens is it will form strictures, like right in the face, it causes contractures. So at the same way, at the same like in the same way, what causes in the esophagus is the acid causes strictures, right? So what do? We give steroid, okay, that is 60 mg per day in divided doses per day. And then we also have to like correct the circulatory shock, okay. And then if there is edema of glottis, if it went down all to the larynx and then all, then we have to do tracheostomy. And then symptomatic treatment, that is either analgesic and antipyretic and antibiotic. So these are all the treatment we should do for sulfuric acid, right? So medical legal aspect, okay. So what happens there is it can be either accidental, like accidentally in chemical lab and all. And then suicidal, it's rare because nobody goes to search for like sulfuric acid only, I will like have some sulfuric acid and die. Nobody thinks that way. In some of the cases there may be, but it's suicidal is rare, okay. So the point is rare is suicidal and can't be homicidal. So nobody is gonna like if they are having to kill someone, then they don't have to wait for 12 to 24 hours, right? So homicidal cannot be done, but they can also as well, okay, who knows. And then in criminal abortion, it is injected into uterus, okay. So this is very dangerous and then very ruthless crimes, you will know about. And then in vitriolage, yes, in the like criminal activity, the person or the jealous people, they can throw any kind of acid, right? So in the sulfuric acid, vitriolage is very common. So now let's go to nitric acid, right? So we have studied our H2SO4, now then HNO3, right? So aqua fortis, it is also known as nitric acid is also known as aqua fortis. And then red spirit of nitri, right? So nitric acid is that. So it is a nitric acid, right? So it is clear, colorless, but it has very much like pungent and choking odor, right? And then it is fuming and very heavy, okay. So clear, colorless, choking odor, fuming and then heavy, right? So now let's discuss about this, right? So what is the fatal dose? Okay, the fatal dose of H2SO4 was also 15 to 20 ml, and then same of the nitric acid is also HNO3, and nitric acid is also 15 to 20 ml, and then fatal period is 12 to 24 hours, same as that of H2SO4. So signs and symptoms, what happens is it is same as the sulfuric acid, right? But it has the following exception. So greater abdominal distension due to more gas formation. So abdomen, it will be more distended, right, due to gas formation. It will cause very much formation of gas, because it's also fuming, and maybe some chemical like changes occurs. And then teeth happens to be yellow discoloration, okay, nitric acid, whereas in H2SO4 the teeth will become chalky white, right? And then yellow discoloration of the TS, wait a minute. So what I have made out of this TS is the skin, okay. So if you like understand what does it mean, so please comment down in the comments below. So let's go with the skin, right? So yellow discoloration of the skin is xanthoproteic reaction, if that's not seen visibly, XANTH xanthoprotic reaction. Okay, so it is yellow discoloration of the skin. And then inhalation of the fumes, it's very dangerous fumes, right? So it will cause lacrimation, and then in the eye it will cause photophobia, and then dyspnea, okay, sneezing, coughing, asphyxia, etc. And then treatment is same for the H2SO4. We can use demulcent, egg white, and then butter, and then we can also do other things like we can go there, prednisone, yes, and then tracheostomy, and then circulatory shock, and then analgesic and antibiotic. Same is there with the nitric acid. And then medical legal aspect, same as the sulfuric acid, like, right? So it can be accidental, suicidal, and then rare, but can't be homicidal. And then in criminal abortion, it can also be used to inject into the uterus, and then vitriolase, okay, nitric acid, also known as aqua fortis. Red spirit of aqua fortis is nitric acid, right? So HNO3. So what happens is corrosive burns, right, around the lips, on the chins, on the right side of the neck. We can all see this is the burn, right? So if this is the esophagus, right? So what happens is yellowish to green discoloration of the mucosa of the esophagus. Look, it's all yellowish and greeny, right? So like this all happens if you have like a nitric acid, right? HNO3. So let's go into the peritoneal cavity, okay, in the stomach. So what happens is black or reddish, that is serohemorrhagic fluid in the peritoneal cavity due to perforated stomach. So it will cause perforation in the stomach that will lead to the hemorrhagic fluid into the peritoneal cavity, right? So that happens. So now let's go to carbolic acid, right? So phenol. So phenol, carbolic acid, it is known as like colorless, prismatic, okay, and then needle like crystals having burning sweetish taste, okay, it has the burning but sweetish taste, and then it turns pink and liquefy when exposed to air. So that is phenol, right? So phenol means carbolic acid plus cresol. So if you have like cresol mixed with carbolic acid, that's the secret formula for phenol that you use in toilet, right? So fatal dose is 10 to 15 gram, okay, grams, because it is crystals, right? And then fatal period is very very less, that is 3 to 4 hours, okay. And then also signs and symptoms include it is also called carbolism, okay, that means poisoning caused by carbolic acid. So what happens is locally it will cause burning and numbness, okay, so it's because of the corrosive action. And then GIT, it causes like from mouth, right? So hot pain from mouth to stomach, and then foreign body tingling sensation, and later anesthesia. So first it will like burn a lot, it will pain a lot from mouth to stomach, it will sting a lot, stinging sensation, and then you will not feel anything, okay, due to anesthesia. And now what happens is dysphagia, of course, and then painful speech, okay, because of all the corrosion. And then respiratory tract, what happens is, of course, there's going to be pulmonary and laryngeal edema, and then order of phenol is in breath, okay, so it is also fine. And then in the systemic, it can cause depression of the CNS, and then metabolic acidosis, the patient goes under metabolic acidosis. And then in the severe cases, hemolysis and methemoglobinemia, okay. And then urine happens, what happens is like it is scanty with albumin and free hemoglobin, right? So it is colorless and slightly green at first, and turns green black on exposure to air, right? So carboluria is due to the hydroquinone and pyrocatechol, okay. So this is the very important thing. Now what happens, so in chronic poisoning of the phenol, right? So in chronic poisoning of the phenol, so what happens, carbolic acid, so what happens is anorexia, no, there is no appetite, and then weight loss very much, and then headache, and then dark colored urine, because first it is slightly green, and then it turns greenish black, and then with exposure it will become like a whole black, right? So that happens. So it will cause dark urine. And then pigmentation of the skin, sclera, and the various cartilages. So it is known as ochronosis. Wait a minute, let's hear how it is pronounced.
Ochronosis. Ochronosis. Ochronosis.
So it's pronounced as ochronosis, okay. So it is seen in phenol, right? Phenol poisoning, okay. So it is seen in the like chronic poisoning of the phenol, right? Carbolic acid poisoning, so it is seen in the like phenol, and it presents as like ochronosis, right? So it happens is pigmentation of the skin, and then sclera, and then cartilages, right? So that is ochronosis. So what happens in treatment? So the treatment is stomach wash, okay? The stomach is washed with plenty of lukewarm water containing activated charcoal, all right? So activated charcoal should be given in phenol poisoning, and then olive oil, okay, and then castor oil, and then magnesium and sodium sulfate, okay? So like you can always use lukewarm water, charcoal, olive oil, castor oil, and magnesium and sodium sulfate, right? So this is gonna be the treatments. And other we can use demileucins, and then saline with 7 gram of NaHCO3, right? So that is sodium bicarbonate, I think, right? So we have to give like saline with 7 grams of sodium bicarbonate per liter in IV to dilute the carbolic acid in blood, and then we have to like promote the diuresis, so phenol poisoning, right? So what are the plenty of like 3 4 things? So lukewarm water, activated charcoal, olive oil, castor oil, olive oil, like it's a charcoal, lukewarm water, and two types of oil, olive oil and charcoal, like castor oil, and then sulfate, magnesium and the sodium sulfate, and then demileucins, and then all the again we have to like diuresis, forced diuresis we have to do, right? So what happens is 7 gram saline with 7 gram of sodium bicarbonate per liter, okay? 1 liter there should be 7 gram of sodium bicarbonate, and then we have to like we have to give it in IV, so that it will cause like blood, dilute the carbolic acid in the blood, and it will cause excretion by diuresis. So that's all happens. So we can see that this is ochronosis, right? So what happens? Look, this is very like dangerous thing to happen. So skin, right? So this is skin skin sclera and cartilages, right? So skin, yeah, you can see the pigmentation of skin. Sclera is not shown in the figure, and then various cartilage also gets have amber, right? So yeah, look, all this black pigmentation, right? So that is ochronosis. Now let's go forward, not back. Oxalic acid, right? So it is known as acid of sugar because it looks like sugar, and then it is also called salt of soreal, okay? So acid of sugar and salt of soreal. So what happens is it is a colorless transparent prismatic crystal, okay, same like phenol. And what happens is here the fatal dose is same as 15 to 20 gram, but its fatal period is 1 to 2 hours, but in the phenol it was always 3 to 4 hours. Yes, 3 to 4 hours, carbolic acid or phenol, right? So what are the signs and symptoms of fulminating poisoning? So if massive dose, is given greater than 20 gram, then it will happen like severe pain from mouth to stomach, and then vomiters will have coffee ground appearance, right? So it is of the oxalic acid, right? Coffee, one is the oxalic acid, right? So vomitus is coffee ground appearance, that is known as oxalic acid, and then it death within minutes to hour, right? So it can happen in if the dose is greater than 20 gram, greater than 20 gram. And in the acute fulminating, right? So word fulminating, and then acute means what happens is like hypocalcemia occurs, that is irritability, tetany, most important one, and then convulsions, right? And then numbing and tingling of the fingertips or legs, that is due to oxalic acid. And then other one is cardiovascular collapse and stupor and coma. So delayed, what happens in delayed poisoning? Okay, so delayed poisoning happens, what happens is uremia, right? It is scanty or suppressed with urine, the traces of blood, albumin, and coagulant crystals. So many kind of coagulant crystals can be seen. So what happens again here is metabolic acidosis is gonna occur, and then VF may be present. Okay, so there are the three type of poisoning in oxalic acid, that is either fulminating, and then acute, and then delayed. So fulminating, massive dose, and then all the coffee ground appearance of vomiters, and then if the person, if they consume oxalic acid greater than 20 grams, then they can have they can die within minutes. And then acute poisoning, it will have a hypocalcemia, and then tingling, and then numbing sensation, and then collapse, cardiovascular collapse. And in the delayed poisoning, uremia will occur, and then metabolic acidosis and VF. Okay, uremia, metabolic acid, and VF. Okay, so what is the treatment of oxalic acid? So we have to do stomach wash, okay, with cautions, because with like calcium lactate and calcium gluconate, 2 teaspoon in each lavage, okay, 2 teaspoon, okay. So that's happened. So any antidote is any preparation of calcium, like oxalic acid, we have to give any like preparation of calcium. Oxalic acid needs calcium to be neutralized, right? So lime water, so very much common, and then calcium chloride solution of chalk in water. Okay, so if someone you find poison with oxalic acid, So first thing you have to do, if you are seeing in school, then go find some chalks. Okay, we have to feed them chalk or calcium, okay, or calcium chloride, CaCl2. Okay, so these are very important. And then in water or milk, okay, so it's also important. And another is calcium gluconate. Okay, calcium lactate, calcium gluconate, and त्याची any chalk, and त्याची any calcium like any preparation of calcium, right? So that includes calcium chloride also. Okay. And dialysis for renal failure, dialysis is very much important, and demyelination drink, and then symptomatic treatment. So what happens is, like, medical legal aspect is, it is like same, suicidal, and then suicidal, and then homicidal, rarely suicidal, and then it is mostly by accidental, can be also be occur, and then used for removing or writing signatures illegally. Okay, so if you have a certificate, and that has a, like, is a degree and all, so if someone, like, has a signature on it, and you don't like a signature, so you don't want to, like, change, you want someone's name to be changed by your names, you are going to do a fraud. So what you will gonna do, you will gonna need oxalic acid, and you're gonna put it in here, right? So what it does, oxalic acid, boom, it will change your name, it will, like, remove, right? So you can write your name and get that degree and all. If you haven't watched that movie, Catch Me If You Can, it's a great movie, it's a good movie by, like, Leonardo DiCaprio, oh my god. And he that is like a true story. So he uses oxalic acid, right? So a little bit of, like, out of context thing also. So if you haven't watched it, go watch it, it's a very nice movie, you will enjoy it. Okay, so caustic alkalis. Okay, now let's move on to caustic alkalis. So what happens in caustic alkalis is, these include ammonium, potassium hydroxide, sodium hydroxide, and then this is sodium carbonate. Okay, so I have written here, if you have forgotten your chemistry, so I have written this for you also: ammonium, potassium bicarbonate, sodium bicarbonate, and sodium carbonate. Okay, so these are the caustic alkalis. So they are most commonest cause of like chemical bonds. So L means liquefatic necrosis, it causes, right? So structure formation is much more common with alkali than with acid. So even though it is more or less, but in both of the cases, structure formation is seen, okay, but more common in alkali. So fatal dose, so we are discussing about caustic alkalis, right? So fatal dose is potassium hydroxide and sodium hydroxide is 5 gram, okay, and then K2CO3, that is potassium carbonate. Okay, potassium carbonate, let me write that down for me also. Carbonate, okay, so potassium carbonate, that is 18 gram. Okay, so if you have to by heart it, or just it can be asked in MCQs though, just like you form a pictorial memory of this. Okay, so and this is Na2CO3, that is sodium carbonate, right? By carbonate, yeah, sodium carbonate is 30 gram, and then ammonia is 5 to 10 ml, right? So potassium hydroxide or sodium hydroxide and ammonium are like 5 grams, 5 this is gram, but this is in ml, right? Ammonia. And then like potassium carbonate is 18 gram, and then sodium carbonate is 30 gram. Okay, and then fatal period is usually 24 hours. So what is done, here is, we have to give demolitions. Okay, demolition within 5 to 10 minutes of ingestion of the alkali. Okay, so these all alkali, right? So potassium hydroxide, sodium hydroxide, fatal dose 5 gram, and then ammonia 5 milliliter, and then potassium carbonate, that is 18 gram, I guess, yeah, 18 gram, and then sodium carbonate, that is 30 gram. Okay, double than that. So we have to do demolitions, right? And in case of mild cases only, mild cases, just wash the stomach carefully. Okay, yeah, and if there is like ammonia vapor, if the person is like inhaled, through ammonia is a gas, right? So if 5 to 10 ml of ammonia is exposed, O2 inhalation, oxygen should be given, right? And then to keep the patient, we have to stabilize the patient as well. So keep the airway patent, and then tracheostomy may be necessary, and then adequate parenteral analgesic also should be given. So other thing what happens is antibiotic for infection and steroid. Okay, steroid for the laryngeal edema, and also the strictures formation also as well. So this was the corrosive poisoning. Hope you liked it. Consider subscribing. Yeah, thank you.